My name is Kenneth Chesick, MD, JD. I'm both a medical doctor, a board certified general surgeon, and an experienced trial lawyer who has limited my practice to medical malpractice litigation since 1984. Now, what is medical malpractice is a question that every potential client has. In order to prove a case of medical malpractice, you've got to show that the doctor or the nurse or the healthcare practitioner breached what's called the standard of care. And what that means is that he or she did not act like a reasonably careful doctor, nurse, practitioner would do in the same or similar circumstances. But in addition to showing what he did wrong or she did wrong or didn't do that they should have done, you've also got to show that the individual was harmed and suffered damages. And the third thing needs to show is that there was what's called proximate cause, that the breach in the negligence, the breach in the standard of care caused and contributed to the damages suffered by the innocent patient. Is a broad overview of what medical negligence litigation involves. A classic case is one involving a pregnant woman who goes into labor, and the doctors and the nurses in the hospital are monitoring the lady and watching her, what are called fetal monitor strips, to see if the baby's contractions and the baby's heartbeat is normal. And when it shows a substantial abnormality, that has to be investigated, and if necessary, labor-induced or a cesarean section done to prevent the occurrence of lack of blood flow and oxygen to the brain of that baby inside the mom. The baby's got to come out. The failure to recognize those abnormalities on the fetal monitor strips and recognize what's called fetal distress is a breach in the standard of care. And those, if the lack of blood flow to the baby's brain is prolonged and severe enough, that can cause brain damage, and that baby will be born with brain damage that will last his or her entire lives. So that's an example of the breach in the standard of care is the failure to monitor, the failure to understand the abnormalities in the monitor strips when they occur, and then to act on those in a prompt and way to get the baby out before the baby is deprived of oxygen and suffers catastrophic damages. So that's breaching the standard of care, that's damages, and proximate cause, the negligent acts and omissions resulted in the baby's brain damage. That's an example of the elements of medical negligence. In all of these cases, by the way, you assume that that the doctor or nurse has a duty to the patient. And when the patient submits to care by the doctor or the nurse, that duty arises to act in a reasonably careful fashion. That's a general outline of one example of medical negligence that occurs in other circumstances as well. But if you have any questions regarding these issues, and particularly if they affect you and yours, feel free to contact us. We're more than happy to talk to you and discuss the care that was delivered to you.